Thanks, Aisha. Great to be on the show as well. We are very happy to announce today the launch of a new company, a new business called Bajaj Finserv Health, which is a 100% subsidiary of Bajaj Finserv. And Aarogya Care is our first product today. The last decade, we've been uh, coming out with health insurance products for our customers through our general insurance company, Bajaj Allianz. We've been financing doctors for their clinics. We've been financing consumers for their health procedures, both cosmetic and non. And we've gained a fairly good understanding of the health space, naturally from a service provider point of view. But when we flipped this and started looking at it from the consumer's point of view, we realized that the consumer actually sees a whole disaggregated system where doctors are independent, medical labs are independent, pharmacies are independent, hospitals are independent. If somebody moves from one town to another, he does not know who to approach, where are the good doctors, how does he get an appointment. So we said, why not put all this together and create a comprehensive, preventive, personalizable, and prepaid set of solutions for consumers. And Aarogya Care is the first such solution that we have launched. And it brings on a common platform, a common digital platform, doctors. So you can identify doctors in your town, you can set up appointments, we build OPD in where required. You can do teleconsultations, which in today's times is what most people would like to do while the pandemic stays. You can connect with hospitals if you have to go to get test centers to send you somebody to take the medical test. So just make it very easy, transparent, and over a period of time, we have a health vault that consumers can voluntarily upload their health records so that even the interaction with the medical fraternity is not transactional. It is something that the fraternity gets visibility over the period of time of their relationship with the patient. And this will help them in creating better solutions. Otherwise, you go to a doctor today, and if you've last gone to them 6 months ago, a year ago, the doctors have hundreds of patients coming to them weekly. They don't remember what was your problem, what was the nature of the problem, the intensity of the problem, how does that relate to the next problem that you're coming with. But the health vault will help us put all this together so that over a period of time, doctors get to see their patients over a period, their health records over a period, and come out with more customizable prescriptions and better solutions. So this is what Bajaj Finserv Health is about, and the first solution, Aarogya Care, is about. Overall, the health as an industry is growing in the mid-teens. It is expected to be over a $350 billion industry in the next 2 to 3 years. Within that, health insurance is playing a very significant role. It is the second largest growing line of business after motor in this country and probably faster than motor in recent years. So we've already started seeing increasingly younger consumers take up health insurance. But the whole process is still, as I said, very individual, very disaggregated. Uh, we believe that there is clearly a set of individuals out there in the tens of millions who are used to the digital experience. And that is where this solution comes in relevant for them. We have seen, for example, in the last 5, 6 months with this pandemic, for some of our insurance policies, we need a pre-medical checkup. And this used to be physical till last year. It's all teleconsultation now, it's using telemedicine. So the world is moving and India is moving towards the digital or digitalization of services. Now, maybe some consumers will go back to the older way as in when this pandemic gets over. But for most people, lives are only getting busier. And if this is done well, we believe that there will be a very large cross section of Indian citizens who would rather engage in this manner. It's infinite because it really, in a smart way, aggregates different providers on a common platform for giving specific and I would say customizable solutions to individuals. For example, I won't let out too many secrets, but we've been working on a diabetes product. Now, there are clear signs that doctors can pick up when individuals are in the pre-diabetic stage. Um, but for most people, this goes unnoticed. Now, we know India is the diabetic capital of the world. So we are working on a solution where we would have a specific solution for diabetes that individuals in their late 20s, their early 30s can subscribe to. It's prepaid. It offers a set of tests where practitioners can pick up the early signs. Patients can tweak at that time just their way they run their lives, the kind of food they eat, the amount they exercise. They don't even probably need to get onto any medication early on, though I'm not a doctor, I must say that. And essentially plan out their life such that they never reach that stage where they get diabetic. Now, when you try to think of what all you need to do to put all this together, to track it over a period of time, that's where this digital world helps us. And that's what we are trying to do. And this is just one solution. But we will have multiple such ones that will come out over the years. That's why I believe the opportunity is limitless. Very much so, because our single largest line, and this is in general insurance, is motor. But there are many more people in India than there will be motor cars or two-wheelers. So this is something where we are heavily underpenetrated. We are not a country with a strong social security. 65% of health costs are borne from the household pocket. There is a big need to not only bring more people into the health system, but also to see that we move more towards prepaid preventive care. And that's why I believe that this will increase dramatically. We have seen on the lending side, we started with financing doctors for setting up their clinics, for equipment over there. We are today one of the largest financiers to doctors around the country. We then went to patients and we said, okay, let's first take care of your cosmetic health requirements. So we are one of the largest lenders for cosmetic health procedures. We then ventured and said a few years ago, let's take care of minor surgeries. So if you have insurance, insurance will pay for that on top of that. And we have a consumer base of over 100 million Indians. So we top up what is required. So it's again easy on their pocket. The last few years now, we've tied up with hundreds of hospitals around the country and moved to the more serious diseases as well. So this has happened step by step over the years. And from that, we have gained significant amount of knowledge and relationship with consumers, with doctors, with hospitals that we are putting together into a comprehensive solution now. That's a bit of a challenge because Finserv includes Bajaj Finance, includes life insurance, includes general insurance. We think the opportunity is tremendous for all of them. If I look at just Bajaj Finance, we've been growing 40% CAGR for the last decade. We've been fortunate with great tailwinds, I must say, because we've always projected a 20-25% growth in top line as something that is sustainable for the long term. This was, of course, pre-COVID. But we are still only 1.5% of the banking system. So again, the opportunity is limitless. It's about doing it sensibly. It's about doing it by placing risk first. It's about keeping consumers' interest in mind and then building a profitable business so that the profit allows us not only to reward our shareholders, but to reinvest back in the business. So it's difficult for me to say each of these blocks that form the consolidated Finserv, how would they grow? But I know that the opportunity is just out there for us to leverage it, and that's what we do day after day. It's a very, very important question. What has really helped us build our businesses digitally over the past decade has been the government's investment in a open platform uh, set of digital products, starting with the digital India digital stack, which had Aadhaar, which had the Jan Dhan accounts, which had the unified payment interface. It allowed for digital signatures. So this open platform of protocols that the government created to enable digital transactions, to enable payments, is something that we have leveraged across our insurance and finance companies. The government has very recently announced a digital health mission, as you know, and a whole digital stack of protocols are getting launched, which includes a digital ID and which includes the digital vault and a number of other, I would say, uh, technologies or softwares which will allow the ecosystem to work together to understand customer data, of course, with customer approval, and come out with better solutions. This ends up including not only urban India, but rural India as well. And even today, as Bajaj Finance is as insurance, we have a very significant presence in rural India where, again, our business is done digitally. So there is no reason why, other than physically bringing the practitioners together one time, we should not be able to expand this digitally as well. Of course, it will happen over a period of time. You know, the two insurance companies are not separately listed. They are still subsidiaries of Bajaj Finserv with our esteemed partner Allianz as the minority shareholder there. They are 20 years old now, but they are growing well, they're growing sensibly, they're growing profitably. So from a Finserv shareholder point of view, he has not had to put in any significant capital into these businesses, and they're getting rewarded with dividends from these companies. They're getting rewarded with the impact on the stock price. So who knows? Who knows? Actually, we've not been reducing our share of crop insurance. Our market share within general insurance companies overall is between 6.5% and 7%. And we try to see that as we run a diversified set of business lines, by and large, most of them are around that percentage. Some may be a little higher, some may be a little lower. It also varies year on year because the competition intensity changes, the opportunities in the market changes. In some years, you see very heavy price discounting, especially by the public sector companies, and it doesn't make sense to overexpose yourself. There are other years where they can't afford to discount as heavily, and we find other opportunities. In retail lines, it is less so because in retail lines, there is a relationship we have built with customers. So we may not be the cheapest, but we know we are quick, we are fair, we are transparent, not only at policy issuance, but in claim handling. So coming back to crop insurance, it is about 6.5-7% of our mix of the overall industry's share. And it again depends, as you know, there are two main seasons, Kharif and Rabi. It depends on what's the dynamic in that season. But if you were to see it over a year, it would normally even out. I would say, Aisha, the picture is still not completely clear. Yes, there is pent-up demand. We are seeing growth because of that. I believe we will continue to see growth with the big festival season coming up. But then what happens towards the end of the year and the first quarter of calendar year 21, we have to wait and watch. It is still pretty much interwoven with the pandemic and the impact of the pandemic on local lives. For example, we saw good growth in June, July, and part of August with local lockdowns. It was terrible because offices were shut down, supply chains were getting broken, and you couldn't get products out there to the market for people to buy. And this was also confusing people as to whether their jobs exist, whether they don't exist. And I think that's where we have to be very clear. This fight against the pandemic, unfortunately, is going to be there for some time till a vaccine is available or medical treatments are available and are administered to the larger population. So we have to work sensibly. We have to follow the protocols that all the health experts tell us to, but we have to keep the economy running. And that's why I believe the focus on health needs to be local, but the focus on the economy needs to be national. We can't have individual cities, states randomly shutting down because then they shut down the entire economy. Again, this is something that has evolved over time. So if you were to see 7, 8 years ago, our life company contributed the largest. Then came the general company, then came Bajaj Finance. And life and non-life probably was about 75, 80%. Uh, it has changed in this period of time. Today, Bajaj Finance is clearly the largest contributor. Then comes non-life and then comes life. Because there's a peculiarity with the life business. When the life business grows well, uh, the because it's a long-term policy, we pay our commissions and book our expenses in the first year under Indian GAAP. But we earn premium over a period of time. So when you grow fast, you actually burn more upfront, but you make profits in later years, so your profit comes down. On the other hand, if you go through a few slow years, then the opposite happens and the profit goes up. But naturally, you want to balance growth and profitability over there. So it's not easy to try and project out in this set of moving parts how you would distribute profits across these companies. Also, keep in mind that we own 74% of the two insurance companies, but Finserv owns a little under, I think, 52% of the finance companies. So even the proportion of the profit pickup ends up being different. But the good thing is they're all growing well, and that's important so that shareholders get a diversified mix of profits from these companies. I would say they're now back to between 80-85% of where they were earlier. And that's a very good sign. Our life insurance business, like our non-life, is distributed very well through the country. And that's why the recovery is quite good because recovery outside of the top 10, 20 cities has been very strong. Top 20 cities, because of these local lockdowns in the last few months, we saw business getting impacted. And that's why it impacted Bajaj Finance more, where a large percentage of our business still comes from the top 20 cities. But it's getting better. August has been better. September is looking okay. As I said, it's very difficult to predict how local governments will react to the ongoing pandemic in coming months. But as long as it is done sensibly and thoughtfully, so that we are not only saving lives, but we are also saving livelihoods, then I think it should be okay. You should see steady improvement. We've been very transparent, Aisha, with what we are seeing in terms of bounces, what we're seeing in terms of probable loss numbers, and we've been issuing this at the beginning of every quarter to the street because who knows where this is going to end and when this is going to end. What we can at least do is, as we are seeing things, we can talk about that. We can talk about the numbers so that different people can project it out for themselves. And clearly, we have seen that people who took the moratorium, over two-thirds of them had never bounced with us earlier, which means they were conserving liquidity at this point of time. And that's why, while those that took moratorium in the first couple of months was close to 30%, it came down in the low teens in the last 2 months. Because as people got more confident, as cities started opening up, business started opening up, they started paying as well. And that's a very good sign. So I'm hopeful that things are moving in the right direction. But because it's very difficult to predict the impact of this pandemic even in coming months, we would rather be extra conservative. We have stocked up on liquidity. We are making the additional provisions. We are working with our borrowers on the collection side so that we can support them at this point of time as well, stay more conservative in our incremental lending. And as we see things improving, then get growth back. The message is very clearly nobody wished for this pandemic. And particularly people at the lower end of the pyramid have suffered, are suffering. For those in the middle and above, it's been a time for reset, time to rethink. Um, but given that we are in this, as they say, never let a crisis go waste. Our companies have become even more digital than before. We have plans where they will come out stronger, better, and we will see that we provide a set of solutions for our customers, keeping in mind what this crisis is teaching us and keeping in mind our customers' needs. Thank you.